Hi there, I'm Dr. Lance Ferguson. This is my partner, Dr. Gary Wortz, and we'd like to give you a cordial welcome to Commonwealth Eye Surgery. It's a big decision to have eye surgery, and it's a lot of decision making. We pride ourselves in individualizing our care. We want to make you comfortable. We want to make this almost fun for you. If we have at the surgical day that we come up, and it should be an experience, not an ordeal.
I just want to say that you're coming to a practice that I joined 5 years ago, but Dr. Ferguson started 35 years ago, and it's built on a foundation of excellence. When you come here, you're going to be meeting people who have dedicated their entire lives to making sure that we have the best skills, best technology, best facility. The ambulatory surgery center where we operate, we have about 50 employees, and all we do is take care of eyes. If there's something that you need, we have people with just decades of experience who are here to meet those needs. We're not doing a gallbladder and a knee and an appendectomy in one room. Our entire facility is just dedicated to basically this specific type of eye surgery, cataract surgery and LASIK. And you're gonna love the nurses. They are probably just our shining stars when you're here. They take such great care of people, and we're just so proud of the facility. And really, it allows us to give patients that care that they deserve and the outcomes that they want.
And it's seamless. We can do our exam here, and we actually have you come back and have your surgery right at the same site. Why do we do what we do? What is our mission here at Commonwealth Eye Surgery? Well, our mission is to improve your quality of life, and that takes time to get to know you, and it helps a great deal if you give us feedback on what your desired vision is, whether that be knitting or surveying or somewhere in between. So we like to think of ourselves as eye surgeons, but also as people doctors who take care of eyes. So the most important issue is you. The most important issue is that we meet your visual needs, and that takes a little bit of effort on both parts. You can help us a lot if you can identify what you place the most value on as far as your visual targets. And we have a form that will help you with that.
Yeah. When you're coming to Commonwealth, one of the things we really want is we want you to start thinking about what your vision, how you want your vision to be after surgery. If you come with some good questions about different options, that's really going to help us inform you about what's going to fit you right. If there was one lens that was right for every patient, we wouldn't have to have this conversation. We would just put that lens in every patient. But we have thousands of lenses on hand here, and our goal is to understand what your visual needs are and deliver on that with all the ways we have to customize your vision, with lenses, with lasers, with other treatments after surgery. Our goal at the end of this is that you are so happy with your vision that you really do say that we've met our mission, that we've improved your quality of life. But that really does require you to make some kind of tough decisions to understand a little bit more about your eye, about how the eye works, about which lenses have certain benefits and trade-offs. But if you can tell us what you want, we feel like we have the technology and the skills to deliver on that. A lot of questions we get surround why will I not see perfectly if I'm coming in to get cataract surgery? And this has to do with understanding how the eye works like a camera. Some patients come in and they've been nearsighted their whole life, and when we talk to them about having cataract surgery, they don't commonly understand that unless they choose to remain nearsighted, that vision that they had is going to be exchanged possibly for distance vision. We have to understand that if we were taking a camera apart and putting new lenses in that camera, whatever lenses we assemble the camera with will determine the focal point of that camera. So it doesn't matter what lens was on there before, it's what the camera has afterwards. And so the same with your eye. It doesn't matter if you were nearsighted or farsighted before surgery. Really, your choice and what you decide that you would like is what we're going to target for your vision afterwards. Now, if you have standard cataract surgery, you're going to get what's called a monofocal lens implant. A monofocal lens implant means one focal point. That can be up close, intermediate, or distance. The monofocal lens implant, however, does not correct astigmatism, and it doesn't correct multiple ranges at the same time. If you have astigmatism and you choose to have a monofocal or basic cataract surgery, you're not going to have the clarity of vision without glasses. If that's what you want, that's okay. But you have to understand going into it that if you have a monofocal lens implant with basic cataract surgery, glasses are going to be necessary for most, if not all, of your tasks after surgery.
Many patients have some difficulty deciding what they value most in their visual range, whether it's intermediate or near or distance. And so we've created a little form to help you decide where your emphasis lies.
Yeah, so when you get this thing, we call this the visual target form. It gives you some ideas of when we're talking about distance vision, we're really talking about far off distance. So sporting events, television, driving, watching movies, and then intermediate vision is sort of arm's length. You sort of think about your computer vision, vision required for cooking, dashboard gauges, grocery shelf, and then we talk about near, we're talking about really more like fine print, like newsprint, cell phone, books, and your tablet. So below here we have sort of a menu, if you will, and it's really up to you and the counselors who'll be talking to you to decide which of these options on the menu is really going to suit your visual needs. And once you select that, that gives us all the information we need to make that happen for you.
Another question people often ask us is what's the difference between laser cataract surgery and standard cataract surgery? Standard cataract surgery is done entirely manually. Laser cataract surgery uses computers to be a little more precise than we can with our hands. It also allows us to fix astigmatism in ways that we cannot do with our hands or with markers as well. So I like to tell people that pilots often complain about autopilots, and they would say, oh, I can fly that airplane better than that autopilot. Oh, no, you can't. I'm here to tell you that straight up. And the same thing with certain steps within cataract surgery. One of them is called capsular rectus that we make. It's an opening in the front of the cataract. I've done 70,000 of these things, and I'm telling you, this boy does it better than I can do it, and I've been doing it for 35 years. So if we get our egos out of the way and allow us to use the best potential of technologies available, we arrive at the best results for our patients.
So many people think that all eye surgery is LASIK or like LASIK, and when they have cataract surgery, they assume they're having some form of LASIK. I am here to tell you that if you're having cataract surgery, it is a distinct and separate procedure, and even if we're using the laser, it's not technically LASIK. The goals, however, can be very similar to LASIK. People who have LASIK want to be free of glasses. They want to have refractive surgery and live their life less dependent on glasses. And with cataract surgery, especially with laser cataract surgery and the refractive lens options that we have, we can achieve results that are very much similar to LASIK. But no, you're not. If you're having cataract surgery, you're not having LASIK.
However, that does not mean that we cannot augment our refractive cataract surgical results with subsequent LASIK or subsequent PRK. But that is what we call an enhancement or touch-up, and it's probably only required in maybe 1.4% of the entire population that elects for refractive cataract surgery. Astigmatism. Patients often inquire, what happens if I don't get my astigmatic error fixed, either with a specific type of implant or with laser cataract surgery? And the answer is, we can still fix it, but we have to fix it with glasses afterwards. Your vision after surgery will probably be better, but it won't be as good as it's going to be with glasses, because glasses will fix the astigmatic error postoperatively. If you elect for refractive cataract surgery, then we can either fix that astigmatism by changing the shape of the cornea or implanting a specific type of intraocular lens that will correct the astigmatism internally in the eye. Monovision. Patients who have successfully achieved monovision, focusing one eye at distance and one eye at near, or one eye at intermediate and one eye at near, are the best candidates to have that same type of visual plan post-operatively after cataract surgery. We can determine your focal length, and we can implant specific intraocular lenses that will help you achieve that. However, we need to know who is a good candidate for that prior to the surgery, and the day of cataract surgery is not the time to decide if you want monovision. A good exercise, or the best exercise to determine that, is with your local optometrist in which, although you have cataracts and your vision is blurred, attempting to put contact lenses in to simulate what it would be like post-operatively. Some people can tolerate very well, some can't, and we'd like to know that preoperatively. Recently, technology has expanded to include a lens called the Vivity IOL, and the Vivity IOL is unique in that it does not cause a lot more halos and glare than a standard intraocular lens does. In previous iterations of multifocality or multifocal lenses, the biggest complaint was persistence of halos and glare and difficulty with night driving. The Vivity basically stretches our focal point without causing a lot of halo and glare, and it's been a very popular model. However, it does have some limitations, and it may not completely satisfy your needs for near vision. And we have some other options for that, namely the PanOptix.
Yeah, and even with the Vivity, we do have the option of doing a version of monovision called blended vision, where we use just a slightly more powerful Vivity in the non-dominant eye to give a little bit of a boost to that near vision, so that the eyes are really still working like a team. One eye might have just a little bit better distance vision, and the other eye might have just a little bit better near vision, but with both eyes working together, get a great blend. The lens, another lens that Dr. Ferguson just mentioned is the PanOptix lens. And this lens really does give the best range of vision from distance through intermediate all the way up to very fine near vision. And the majority of patients do very well with this lens. We've used it with great success. But there are occasionally, maybe 1 to 2% of the time, patients do have persistence of glare and halos or quality of vision issues. And it's possible that that lens may not agree with everyone. And if that's the case, it's a reasonable choice to remove that lens in about 1 to 2% of patients. Again, we've had great success with it. It's a wonderful option. And if you're a multifocal contact lens user, again, we know that your brain is already kind of adapted to that. And if you have demonstrated success with that, we have a really strong hunch you're going to do great with a PanOptix lens. It doesn't mean that that's the only group of people that will. We do this on people who haven't done multifocal contacts. But again, it's just something you have to understand. There's some nuances with every choice.
The neuroadaptation that we're talking about is basically the way your whole visual system works. And just remember this, your eyes are a camera. Your eyes take a picture, but we see with our brains.
Some patients, when faced with all these choices of options, they kind of freeze. They don't want to make a decision. They say, well, what if I just do standard surgery now but want to upgrade later? And I'm here to tell you that there's a lot of reasons we want you to make a really good decision, kind of a lifetime decision for your vision before cataract surgery, something that you feel like you can really live with. When we do surgery, we're choosing a lens that should be right for your visual needs, and that lens is really good for the rest of your life. Now, that doesn't mean that if for some reason you don't tolerate that lens, or another lens comes out that you feel like you would like to try, or you have a really good reason that you would like to try different technology in the future, it's not impossible that we couldn't change the lens out, but it is expensive. It can be damaging to your eye in rare cases, and we would just rather you make the best informed decision that you can that meets your needs before cataract surgery. And that's why watching videos like this, before you make that decision, really starts helping you get in the right framework for making a decision when you come in. When you've talked to the doctors, you talk to your family, and you make the decision that is going to be best for your future. Another question we get is, what if I never get my cataracts removed? And I think this is really talking about timing. And some people used to say that you've got to wait for your cataracts to get right before they're ready. And so when I talk to patients about whether or not it's time for cataract surgery, I tell them, if it's not bothering you, it's not bothering me. If you're not having any trouble, let's just wait. There's really no problem. Go ahead.
With the caveat that sometimes the cataract gets big and thick in the eye, and it can push the iris up against the drains of the eye and cause glaucoma. It also can leak fluid that causes glaucoma. So provided you're not in those categories, then you can wait, as Dr. Wortz suggested.
Exactly. So if it's not causing medical problems, or if it's not causing you visual symptoms, it's okay to wait. However, if the cataracts are bothering you, we know the cataracts are only going to get worse over time. Eventually, it can cause blindness. And so really in this modern era, there's no reason for you to wait. until it gets to a point where you're no longer functional. And we do know that, eventually everybody gets cataracts, and if you don't get them taken care of, they'll get to the point where it really bothers your daily life. And that's what we're here for. We're here to help people see better, and we don't want people going blind needlessly. Yeah.
And I think the other issue too is the longer you wait, after a certain point, the cataract becomes so dense that we have to put a tremendous amount of energy into the eye, and that's deleterious to the inside surface of the cornea, and can cause problems that way. So you don't want to wait till it's a stone, till it's so hard that it's going to cause some higher risk of injury to your eye in the simple removal of cataract.
Exactly. Many of our patients who have cataracts also have glaucoma, and so sometimes we get the question, does cataract surgery actually improve glaucoma? And studies have shown that for a temporary period after cataract surgery, usually the pressure goes down. Just by getting that big bulky lens out of the eye, it actually improves the outflow of the aqueous fluid, and you get a temporary reduction in pressure for a few months. However, it's really not a long-term fix. The good news, though, is there are some combined procedures that Dr. Ferguson and I both do that we can do at the time of cataract surgery that have proven to really reduce pressure and reduce your dependence on eye drops to lower pressure after surgery. So if you're a patient who has glaucoma and you're sick of drops, or you're potentially not being well controlled, your pressure's too high even on therapy, we would really love to help you get your pressure under control with some simple procedures we can do at the same time of cataract surgery.
Will cataract surgery cure my floaters? When I turn my eyes left, right, up, and down, I see all these little bugs. Those are a normal happenstance in almost everyone's eyes, and people have it to a different degree. Sometimes after cataract surgery, you'll actually see a few more floaters simply because the density of the lens has been replaced with a better, clear intraocular lens. Floaters are in the gel of the eye. They can be removed separately with a different procedure called vitrectomy, but that's a totally different procedure. So if you have floaters before cataract surgery, you will have them after cataract surgery. Patients with cataracts often notice a scatter of light when they're driving in the evening or at night, and they see starburst and halos and glare and those kind of things. And when we take the lens, the cataract out of the eye and replace it with the standard lens, it markedly reduces those symptoms. However, there are some implants that we use that impart greater depth of focus and impart multifocality that may have a marginal increase in your halos and glare.
Yeah, I think for the most part, patients are going to notice a huge improvement in their glare and halos. That's one of the most common reasons we get patients coming to cataract surgery. They say they don't feel safe driving at night anymore. And I think all the lens options are going to improve those. And really, depending on what you want, we do have some options that have some trade-offs. But for the most part, patients remark about how much better it is to drive at night after cataract surgery.
Agreed. Another question we get is, will my cataracts come back? And there's a lot of confusion regarding this. It's also called an after cataract, and the technical name is opacification or hazing of the posterior capsule, which is a membrane we leave in the eye to support the implant. Think of the cataract as a peach with clear skin. We take the front skin of the peach out, we take the peach pit out, we take all the fruit out, and in that clear envelope is where we put the implant. That back cellophane, which starts out like saran wrap, can become more like, cut-right wax paper over a period of time, and maybe about a third of the patients. In that instance, we simply use a laser to make an opening in the center of that membrane, and it basically restores the visual axis. So the cataract doesn't come back. A membrane that's in the eye, purposely left in the eye for support, can become hazy over a period of time, and we basically open up that membrane, the very center of that end membrane, and we leave the periphery of that membrane that anchors the implant intact.
This is Dr. Gary Wortz, and on behalf of Lance Ferguson and myself, I want to thank you for watching this video. Hopefully it has provided you with some good information and answered some questions you might have had about the procedure itself. We look forward to seeing you and answering any further questions you might have. Thank you.